Do feet. We have 3 projections of the feet that we're going to go over today. We're going to do the AP axial foot, the AP oblique medial rotation foot, and then the medial lateral foot. So we're going to start with the AP axial. We're going to lift the patient's leg up and put the foot flat on the IR. So if you will just bend your knee up for me. Little tip here, piece of advice. When you start out, make sure your foot is aligned with the patient's hip. If their knee is too far inward, it's going to make it hard when you try to do your oblique. You're not going to have a lot of range of motion in. So just go ahead and kind of slide that foot over, keep that knee straight out, and then we'll put that plantar surface down. Now, where are we centering for this?
Base of the third metatarsal.
Base of the third metatarsal. So hold on. Where is that? I know all of y'all can see with your x-ray vision, but let's use this, and we'll put it right beside her foot. So if you notice what happens with the metatarsals, your arch of your foot brings the base of the metatarsals upward. So the higher the arch, the more off-centered the base of that third metatarsal is, right? So for this, a little tip that can help you too is if you take your fingers and hold them flat and run them along the edge of your patient's foot around the side, you'll run into that tuberosity on the fifth metatarsal. Come straight out from it and a little bit in, and you'll be at the base of the third. If you look, here's that fifth tuberosity. If you find it, come up and come in just a little bit. There you are. Now, if you have a flatter, a patient has a flatter arch to their foot, it may not be as over as far, it'll be more centered to the foot. Okay, that's just a good way to help you see. Now we got to angle our central ray because we're doing an axial. Axial means angle. So for feet, what is our angulation? 10 degrees, cephalic or towards the heel, posteriorly towards the heel. Coming up to 40. I want to make sure her foot is nice and straight. That means heel, toe, all coming straight. I don't want my heel kicked out. I don't want my toes kicked in or outward. Make sure her pants legs are rolled up, okay? Elastic pants, jogging pants, anything with thick denim, thick bottoms need to be pulled up out of the way. So let's see what we've got. Let's open up this collimation so we can check our edges to see if we're lined up here. I just need to do a little bit of adjusting. Bring your knee straight up. I want to make sure her tibia and her fibula, bring this arm out and bring your knee kind of up. Keep plantar surface down. And I'll just pull you over. That one right there. And then we're collimating 1 inch on the side. 1 inch past the toes. And if you're 1 inch past the toes, you should have 1 inch at least past your calcaneus. Right marker goes on the right side of the right foot. Patient is going to be shielded. And I would tell her to hold real still. Beep. You can relax. For AP axial, we're doing the axial to open the joint spaces. This is going to show the base of the metatarsals superimposed here. Technique 70 at 1.25. Questions about AP axial? Leave your patient right where they are. Go into changing this. We're going to take the angle off for the oblique, going back to a 0 degree. Staying at 40. And down, line back up to your IR. And then we're just going to roll our patient's knee and lower leg. The knee and the lower leg will control the angle of the foot. How much am I going to oblique the foot? 30 degrees. Still coming in, base of your third. It's just a slight angle. I still want to have all of my metatarsals seen, but I do want to open them up just a little bit, okay? So have this angulation. This medial oblique is really good for seeing the sinus tarsi. What else can we see on the medial oblique of the foot?
Is it the cuboid?
Cuboid and the fourth and the fifth metatarsals. So this is showing us this lateral side of the foot with the medial oblique. Watch the heel, y'all. Make sure it doesn't kick out. If it does, you just kind of want to straighten it up. I kind of go by the edge, the side of my foot. I should pull that back right there. Making sure that everything is nice and straight. 1 inch, all sides. Questions there? I think we might have slid up a little bit, didn't we? That's it. That's your medial oblique. Let's do lateral foot. Now, for lateral feet, which way are we going to rotate our patient?
Externally to the right.
Yes, because this is what type of lateral?
A medial.
Mediolateral. So mediolateral means that we are coming into the medial side with a central ray, exiting out the lateral side. So patient, can you roll onto your right side for me? Good. And I'm going to turn my IR so that the long axis of the IR matches the long axis of her foot. Now, for laterals, we do need to dorsiflex the foot. Dorsiflexing, oh, that's perfect. Do that again. So when I want my patient to dorsiflex, just bending the toes is not dorsiflexing, okay? The dorsiflexion actually happens at the ankle. So don't get in the habit of telling your patient, can you turn your toes up for me? Because they will literally just turn their toes up. They won't dorsiflex at the ankle. So what I tell my patients is, can you bend your foot up at the ankle? And she can over dorsiflex her foot, very talented. So we are going to just relax that a little bit. It should look like a letter L. Now, where am I centering with this? I want my central ray coming in still to the base of the third. So the line that's coming across the top of the foot will be at the level of the base of the third, okay? This line is going to be coming straight down through the foot. Now, with feet on lateral, watch your plantar surface. See how her plantar surface is what I'm going to call oblique right now? I need that to be making a perpendicular line to my IR. Anybody know how that's controlled? What? The knee. That's exactly right, the knee. So what we're going to do is just lift your knee a little bit. See what happens? Brings it up. And then I'm going to just pull my IR over so that I know my central ray is going to be coming here straight through.
Yeah, something like
Do you have a sponge right there that you can grab? Put something, a pillow, a sponge, whatever you can find, folded sheet. Yep, that would work.
Yeah,
That just gives them some support, and it's not as hard for them to keep the position. And then we will take our central ray. All you really need to do is, don't really have to do that. Line up to my IR. I need my talar domes. That is going to be where at the top of your talus. Both of these domes were arches. They need to be superimposed with one another. And so what I'm going to do is just pull this back some to make more of an L. That's going to allow, and I can feel both of the malleoli, make sure they're on top of one another. Plantar surface is perpendicular, coming in straight across base of the third. And this is going to be my lateral foot. One inch past my toes, 1 inch past my heel, and I should have 1 inch above the malleoli. Open that up just a little bit more. The reason that I'm doing this, if you look here, if her foot is too far back, are my Metatarsals going to be superimposed on top of one another. I have to bend that knee up to get the metatarsals all aligned. Okay, you may even have to put a little bit bigger or either double up the pillow.
So what about her toes?
It's okay. One of her toes wants to push down. That's okay. I'm focusing right here on these metatarsals. Remember, you want the head of the metatarsals to be superimposed for sure. That's going to be right through here. That's your lateral foot. 70 at 1.25. Any questions? She'd be shielded too. Don't forget your shield. All right, let's practice.